Welcome back, and before going on to the break, Shahzad alluded to the sort of conversation that we are developing, and particularly I think Shahzad is excited for this conversation because there is a very personal touch to the conversation that we are going to develop, and we are going to talk about the physiotherapy particularly and what exactly does it entail. And since he is a sports person, so I think sports person, and every now and then they are usually facing the injuries. So what exactly does the physiotherapy mean? So it's more of a holistic approach that deals with the diagnosis, prevention and the cure and the management of the pain. But I think Shahzad has a story he wants to share. So Shahzad, why don't you
Exactly, obviously, pretty much all of those people who are out there who've been watching me on television or have been following my journey, they do know for a fact that, that I went through a back surgery myself. Physiotherapy is there to kind of make sure that it heals you in a way or manages your pain in a way that you could avoid surgery. Now, the only problem back then, I think I was 22 or 23 years old when I got my surgery done. It was really difficult for me to kind of find the right guy, who could treat me via physiotherapy. But unfortunately, at that point of time, what I realized was that most of the time that the people who are actually into physiotherapy are quacks. Certainly would not know what they really need to do, and it's more of a business. But eventually I figured out that now that, that we've been speaking about it on television, there are a lot of people who are doing some good job, which is why we have somebody over here, really interesting. He's been with the Pakistan Cricket Board himself as well. And what better can it get that, that a person who's actually been giving physiotherapies to the national team of Pakistan cricket team, so I think it actually gives you more confidence and personal knowledge into what physiotherapy is and how can it help you. So ladies and gentlemen, we're very lucky that we've been joined by Dr. Azaz Ali, who happens to be a physiotherapist himself. He's got his clinic in I8. Assalamu alaikum, good morning, how are you?
Wa alaikum assalam, thank you so much for inviting me to your show. It is a TV channel we are grown up just watching PTV.
Thank you so much.
And it's really an honor for me to just.
It's an honor for us to have the the right person with us as well, because you've served with Pakistan Cricket Board yourself, speaks volumes about your profession. So do you think that I'm wrong where I'm saying that back in those days physiotherapy was most of the time something which was a business rather than something which could have healed you?
And I think pain management is a very delicate subject when it comes to that, and if you are not in the right hands, it can severely impact you, and rather than decreasing your pain, it can conversely increase your pain a lot. So how do you
as for the physiotherapy, the physiotherapy is not only dealing with only pain. We are treating the mobility, we are treating the neurological condition, we are treating the old age patients like geriatric population. There is pediatric physiotherapy. The physiotherapy is developing these days in Pakistan, like from 2008 in Pakistan the doctorate program is started in Pakistan, and then in these days the sports therapy, the orthopedic manual therapy, the neurological physiotherapy, it's working really good. And the patient by the conservative management, we are just treating patients with the strokes, with the pain, with the disc injuries, and also with the cerebral palsy. So if we come to his point, the intent of any doctor is not that my patient shouldn't be healed. Every doctor wants that his patient should be treated in the right way.
Exactly.
But lack of education, lack of experience leads to those sort of situations.
Because this is something that I've witnessed myself. Now imagine what used to happen was that this physiotherapist that I used to go to, I mean obviously where Hajar said that it needs to be more of a holistic approach, right? Now imagine that gentleman would only put electrodes onto me, turn on the current for 30 minutes or 25 minutes, and that's it. No stretching, no breathing exercises, nothing to kind of do with where the pain is and how it's going to get better. And every time I would ask him, okay sir, am I going to get better? Ab 2 mahine ke session le le, ab theek ho jayenge. Now this is something which was always very concerning for me, because it was more of a business. So how do you think that at your clinic you make sure that it's more of a holistic approach, everything comes together to kind of get the patient right?
The physiotherapist is the engineer of movements, the engineer of mobility. But the mobility is not only come from your muscles and joints, the mobility comes from your system. You need to go through the system. There can be malnourishment. Now, the malnourishment is not like to just not eating the food. The malnourishment can be in a form of dehydration,
Yeah.
the malnourishment can be in a form of deficiency of nutrients. So in the first point, in most sports person these days, in gymmers like you,
Yeah.
you have a
I
really
used to
good
go to
mass
gym
of
now
muscle
because
on
of
you.
the injury. I cannot go to the gym. It's been a month now. Yeah.
So the dehydration is one of the leading cause of injuries in the sports person. And also the electrolytes imbalance is the cause of injuries these days, because muscles have some qualities. The muscle have a specific function, we call it spasm.
Yep.
Spasm is a pathological condition, but the spasm can be formed for the protection of the body.
Okay.
Just like if you have dehydration, you have electrolytes imbalance. Also, if you have a lack of flexibility in your muscles, so it can lead to injuries. That's like I'm telling you, a very larger group of muscle in your body, we call it hamstrings.
Yep.
In the legs. These hamstring muscles is leading you to the injuries, and these hamstring muscles is leading you to a healthy life.
True.
So a short or stiff hamstring muscle can lead to a surgical condition like yours.
Yep.
So at that time, if you are assisted by a expert physio, so you can avoid. But now you have done it, and you have another injury right now. I just saw in the morning.
I think it's post-operation, but after almost 15 years, that I've gotten this injury as well. Unfortunately, that it got too serious, and certainly we'll look at it as well. We'll make sure that you kind of give it
May
a look
Allah
as
give you
well.
shifa.
I mean, that's what we want, everybody to pray for as well. But in addition to this, where you have actually spoken about hamstring, there was this one common problem which I've seen in Pakistan. That's its sciatica, right?
Yes.
So when we speak of sciatica, I think majority of the population goes through that pain. May it be because they are obese, may it be because their work is such where they have to pick up heavy loads as well. How do you think that you treat sciatica, and do you think that you've had successful people or patients who've actually recovered successfully? Do you think you can share an example, and how did you do that?
Just like ma'am told me in the start of the segment, that the right diagnosis can lead to right treatment.
True.
First of all, the sciatica is misdiagnosed with other conditions.
Okay.
Like there is other condition which is piriformis syndrome, there is a localized muscular spasms, but whenever a person got pain in his lower back, he just every doctor tell them that this is sciatica.
MRI karao, operation hoga.
Yes, MRI is like agar let's go for MRI. I'm a healthy person, I don't have any pain in my back. If I go for MRI, there will be a disc bulge L4, L5, L5S1, because it is a process of degeneration.
True.
It is a process of age-related
It will
changes.
be there, yeah.
It is a process with the spine is adjusting itself with position with the age.
Okay.
So the next thing is sciatica can be treated with physiotherapy, but not that much extensive physiotherapy, like you have to go for 2 or 3 months of physiotherapy.
All right.
You need a proper guidance from your physiotherapist. Like the sciatica always caused by the lifting weights in your bending.
Yep.
And also the long sitting, and also the wrong posture during your sitting.
Exactly.
So you can apply the reverse mechanism to those movements, and you can just heal the disc.
Wow.
But disc takes time, just like every tissue in your body. During healing it takes time. If you have broken bones, if you have a broken muscle, if you have a torn ligament, it's need time for the healing. So the disc, there is a natural phenomena of the disc. The natural phenomena of disc is it shrink itself after a few months.
True.
So you have to give time to the nature first.
Exactly.
And
thank you so much for saying that, because I think this is for the people out there, and you very rightly said it, that people a lot of times are actually kind of prone to injuries because of dehydration as well. So you really need to keep yourself hydrated. More water will heal you.
Shahzad, thank you so much for pointing it out, because certainly you also alluded to the conversation that we want to develop is that lower back pains, and which are very common nowadays, and it's not sciatica, and it's intersection with the sort of lifestyles that we have developed. So I mean, we're not moving that much. We are usually sitting, we usually go in the cars, and especially for the people who are working in the corporate sector, so they usually complain about the lower back pains because they're constantly sitting at one particular place, they're constantly working, and the working hours are very tough, right? So how can we treat this particular problem of the lower back pains, because they come in a multiple form, for example scoliosis, for example sciatica, and all of these problems, and they're becoming very chronic, and in very younger age we are seeing its emergence, right?
There is always the cause of sciatica is muscular. If you have weak muscles of your core, of your abdomens, and if you have stiff muscles of your core and your abdomens, it can lead to sciatica, because the certain arch of your spine is maintained by the muscles. If a certain group of muscle is weak and another group of muscle is, like we have muscles, the agonist muscle, the antagonist muscle, the synergist muscle. Sometimes the pain is not caused by the agonist muscle, it's caused by the antagonist muscle, but it's restricted your movement. If you have a continuous stress on a specific group of muscle, and that stress causing scoliosis and also the discompression and nerve compression in your spine, so it can lead to sciatica too. And if
that's when it becomes really difficult to heal it as well, because the muscle stays in spasm. It can certainly, you know, the way your body is, it will have impact on that. And then unfortunately, if it stays in spasm for a longer period of time, you could actually experience disc prolapses as well.
And you are encouraging us by your body mass. So obesity is a very common cause of sciatica these days, because when a person is obese like me, so the arch is disturbed in your spine, which is like a C-shaped arch, and it gets stressed because the spine isn't able to lift that weight of your tummy and the fat mass in your body.
And in addition to this, let's speak about frozen shoulder. That's one of the most common issues these days in Pakistan. And I went through it myself, you know, for a longer period of time. I had to do a lot of exercise to kind of get back to that. And alhamdulillah, it's all because of Allah. First of all, I think this is something which everybody needs to understand, that if you're in good shape, you know, if you're healed, you know, if you're recovering, it's all because of Allah. The kind of life that you're living, so always be thankful. What about frozen shoulder?
The frozen shoulder, it is an inflammatory condition. We call it adhesive capsulitis in your scientific language. Now, there is a certain capsule which gets inflamed, but what's the cause of inflammation? The cause of inflammation is majority causes, more than 90% causes, is diabetes. When there is a hidden diabetes inside you, there is insulin resistance, there is uncontrolled sugar in your body. It leads to inflammation of connective tissues in your body. Sometimes it hits your knees, sometimes it hits your lower back, sometimes it hits your shoulders. So whenever it hits or inflamed your connective tissue of your shoulder, it leads to hypomobility, like the movement is restricted and there is pain during movement, which is causing you know, a sleepless nights and also a severe pains during movements. So in adhesive capsulitis, the first thing should be treated is your metabolic cause, and you have to control your sugar first, you have to work on your diet, and then you have to work with it secondarily with physiotherapists on your mobility, on your pain. So if your sugar is not controlled, so you can't go for a healthy shoulder, or you can get rid of your adhesive capsulitis
as well. And imagine, you know, my Maji obviously has been doing quite a lot, alhamdulillah, thank you Maji, Walid Saab. But imagine that, you know, I've been telling them, okay, that my, you know, right leg feels a little weaker. She's been giving me paratha every single day made up of desi ghee and yakhni and all of that, which actually brings me to this point, that at my age now, this is something that I've realized, that we really need to kind of make sure that we take more of folic acid, more of iron, more of magnesium, vitamin D, B12, because now what happens is the majority of the population, whenever they're going to get tested for vitamin B12 and vitamin D, I think that's where the problem lies as well. Would you recommend that?
And I think one last question I would like to club in with Shehzad, because Shehzad is also suffering from you know, some sort of pain, and he has been going through that, and I've been witnessing that. And one thing that especially our mothers, and you know, and especially in Desi households, they come across is that whenever there's pain, our mother will say, you know, let's massage with the oil, right? Yes. And I think massage is something that is very common, right? So do you prefer, I mean, going with that therapy of the oil massage, because sometimes it aggravates the pain, right? If you don't know, you know, which is the posture of the massage, or you know, what is the right method for doing that, then what would you recommend?
And when to put ice and when to give it takor.
First, let me just come to his question. His question is,
folic acid, magnesium,
there is
vitamin.
misconception between the sugar intake. Like we don't know which.
Parathe mein bhi badi chini.
Yes,
Yeah.
sugar is in rice, sugar
Roti.
is in fruits,
Yeah.
sugar in is wheat and all
Yeah,
those
And
things.
bakery.
So you need to be really careful and you need to consult a proper dietitian for it.
Dada
What should-
paratha itna mazedar tha, can't even explain, mashallah.
and then the next thing is your
What
question
about
was-
the micronutrients as well, and what about vitamin B12, vitamin
you
D?
have to take it as a supplement, but the deficiency is a pandemic these days.
Okay.
Because vitamin D is a pandemic, the vitamin B12 deficiency is pandemic, because as for that there is no certain food for us, there is no sun exposure
Well,
these
धूप में
days.
भी जाते हैं, there's no way that we could actually lie
We are
down with our
living in
clothes off,
sedentary
yeah?
lifestyle, and
Yeah.
we come to the massage therapy. Massage therapy is a component of physiotherapy,
Yes, yes.
but you need to know the proper timing of massage.
Yes.
If you go, like he have acute injuries, this is 24 or 48 hours before he got an injury. In that sort of condition, you go for the massage. For the time being, for an hour, for 30 minutes, the pain will be reduced. But after that, the pain will go to the threshold level.
True.
So you
Right.
don't need to go for a massage when there is injury in the first 7 days. And
Right.
after 7 days, after consulting with a physiotherapist, you can go for the massage, because the muscular tightness can be addressed with myofascial release therapy, which
Right.
is a component of physiotherapy.
That's wonderful. And, thank you so much, Dr.
Thank you
Azaz,
so
for
much.
being with us. Lovely to
Thank
be
you
in
so much.
conversation with you. For everybody who's out there, I've spoken about it before as well. His clinic is in I8, right under the active gym as well. So please make sure that, God forbid, if there's some problems, you go to the right guy. I think that's something which we really need to identify. And that was the point of whole conversation, to have the right guy, go to the right guy, so that they can help you. If you've been to a physiotherapist where he will only put the electrodes onto your back, no stretching, no holistic method of kind of making sure that you're going to get better, I don't think that you need to go to the same therapist as well. And imagine that if you go to a physiotherapist and right in the beginning, he tells you that you will need sessions for 2 months and I will give it to you for 60,000 rupees. You know it there and then that he didn't even really try to figure out what the diagnosis needs to be and what is the kind of therapy that you need. So please make sure that you're wise with it, because unfortunately, if you are with the wrong person, that can aggravate your injury rather than healing it. So please make sure that you make the right decision. You want to say something?
I think that's it. You have surmised it beautifully, and with that, we will bid you farewell. Until next time, it's a goodbye, Allah Hafiz, and good morning.
Morning.